it.
Well, I think it's wonderful that he's recognised some brilliant Kiwi science. So yeah, that's a big win, I guess.
But it is in emissions from both ends of the cow that New Zealand is an innovator. The Agricultural Greenhouse Gas Research Centre in Palmerston North is conducting a range of experiments to slash methane from burping cows. The centre's director, Harry Clark, says the attention is pleasing.
It really is always lovely that your work is recognised, and I think we've got to thank successive New Zealand governments for their foresight.
Harry Clark says the work could slash emissions from individual animals by more than 30%, which is welcome given New Zealand's goal to nearly halve methane by 2050. Day one of the two-day leaders ended on an up note, a pledge from 100 countries to end deforestation by the end of the decade. And some big polluting countries also made new emissions reductions pledges, but there were fishhooks in most of them. India's net zero promise takes effect decades too late. Tricky accounting makes Brazil's pledge actually an increase. And US President Joe Biden reiterated an earlier promise he lacks the votes to make happen. New Zealand-based Pacifica climate activist Brianna Fruin says if the heads of state at the COP26 climate summit fail, the people will step up.
I believe that COP is like a compass, that we're all in a collective canoe, and if we're able to get COP right, we can be pointed in the right direction. But at the end of the day, my ancestors traveled the oceans without compasses. So if COP doesn't work, the people will.
Brianna Fruin says Pacific countries are already living the reality of climate inaction. But she says Pacific people are not victims of the climate crisis, but beacons of hope.
This is our warrior cry to the world. We are not drowning, we are fighting. This is my message from Earth to COP.
The second and final day of the Leaders' Summit starts later tonight, New Zealand time.
And that was Hamish Cardwell reporting. E te iwi e haere aki nei I a checkpoint. The COVID-19 Minister Chris Hipkins will make an announcement in the next few minutes about alert levels in Northland. Now, we'll take that announcement live and have reaction as soon as it happens. Don't forget, we'd love to hear from you, homai o whakaaro. You can send us your feedback by text 2101. You can tweet us at Checkpoint RNZ or flick us an email, checkpoint@rnz.co.nz. Let's get to the headlines now. Ko marama anō tēnei.
Thank you, Lisa. The COVID-19 Response Minister Chris Hipkins is to hold a media conference at any moment at Parliament to discuss alert levels in Northland. There was one new COVID-19 case in Northland today, a household contact of an existing case. We'll go to the media conference when it begins. The Prime Minister was earlier repeatedly heckled by a member of the public in Northland, forcing her to temporarily hold her own media conference. Jacinda Ardern had been in Te Tai Tokerau promoting vaccination efforts. She says vaccination opponents are a small minority but very vocal. Local government New Zealand says violence and abuse towards council members is on the rise. Auckland councillor Josephine Bartley was threatened by 3 men at a vaccination centre on Sunday. The chief executive of local government NZ, Susan Freeman Green, says the country is losing its ability to openly discuss issues that affect the community. She says it's part of a trend to attack the person, and that will stop people from standing for local office. A man on bail for attending an anti-lockdown protest in Auckland has been bailed again after attending a second demonstration and breaching his release conditions. 57-year-old Paul Thompson has been charged with failing to comply.
Kia ora koutou, everybody. Sorry to bring you in so late. As reported earlier, there was one new case in Northland today. The case is a household contact of the case that was reported today. Despite extensive case interviews and contact tracing over the last 24 to 48 hours, our contact tracing teams have not been able to find an epidemiological or person-to-person link with any other cases in Northland. Furthermore, these two cases are based in Taipa in the far north, so are geographically quite separate from the other Northland cases, which are centred around Kaipara, Kaikohi, and have locations of interest in Whangarei, Kaiwaka and Wellsford. The two new cases have not been near any of those locations, nor come into contact with any of the other cases in the Northland outbreak. So it's unclear at this point how they could have possibly picked up the virus. This means that there is a strong possibility that there is one or more missing links in the chain of transmission, and that means that there could be undetected community transmission occurring right now in Northland. So on the basis of public health advice, including from the Northland Public Health Team, we've decided to move the northern part of Northland into Alert Level 3 from 11:59 p.m. tonight through to midnight on Monday, while we do some extensive testing, contact tracing, in an attempt to find any missing link. The decision will be reviewed by Cabinet on Monday. However, in order to minimise the unnecessary disruption to the whole region, we're putting in place a boundary which will run through the centre of Hokianga Harbour to the Mangamuka Junction on State Highway 1, to the Kaio River Bridge on State Highway 10 and East Bay. Below this boundary line, the rest of Northland will stay at Alert Level 2. Moving the northern part of the northern region to Alert Level 3 is the same step that we've taken with other previous cases where there's been no known source of infection. Using these localised arrangements has also worked previously to help stop any spread, for example, in the Upper Hauraki and more recently in Waikato. Alert level restrictions remain an important tool for us to protect communities from COVID-19 while we get those vaccination rates up. Northland's vaccination rates do remain lower than the rest of the country. At just 79% for first doses, the region has the most vaccines of any DHB in the country still to deliver before it reaches 90% on first doses. These lower rates of vaccination make the risk of an outbreak that much greater, especially amongst the 11,000 Māori in the region who are still unvaccinated. It is our goal to avoid future lockdowns once we get to that 90% marker. So I again encourage anyone and everyone in Northland, or elsewhere in the country for that matter, who's not yet taken up the opportunity to be vaccinated, to do so. As the Prime Minister said yesterday, the restrictions in Auckland are keeping COVID-19 out of the rest of the country at the moment, but it won't stay like that indefinitely. We need people to get the vaccine before the virus reaches them first. There are vaccination sites all across Northland that will be open tomorrow, and there's also testing available throughout the region. Northland's about 17,120 doses short of reaching that 90% target. There is the capacity and the vaccines available to reach that target in Northland over the coming days if people simply come forward to be vaccinated. There is nothing stopping the Northern region hitting that target. The vaccine's free, it's safe, it protects you and your whānau and your friends. With summer fast approaching, the vaccine means we can get back to our normal way of life and enjoy the best that Northland has to offer without restrictions as soon as possible.
I'm sorry if I missed this right at the beginning, but what's making you most concerned? What's prompted you to go to level 3 for parts of Northland?
It is the fact that it is an unlinked case and there is no clear or even probable source of the infection, which means that there will be potentially missing links still out there, still potentially infectious, and there could be chains of transmission that have not yet been detected. And so while we do that work, we want to keep the lockdown as localised as possible, so not place parts of the region into level 3 where there isn't a good case to do that at this point. But we do need to identify whether there's any further transmission out there.
I'll
let Jessica for a second, I'll come to Tona.
The Prime Minister has been in Northland today. When were you first alerted to this, and how is she impacted by this?
The Prime Minister wasn't in the area that we're moving into Alert Level 3. With her travels, the Prime Minister does travel around the country. The Prime Minister is very careful in terms of the nature of activities that she undertakes. So at this point, there's no additional risk there. The Prime Minister's not been in contact with any potential cases, not been in those areas where there is concern or greater concern at this point.
How much would bearing to those significantly low vaccination rates in Northland contribute to this shift in alert levels for the region?
Well, if they were sitting at 89%, maybe we might be having a different conversation. But those are quite low vaccination rates. As I indicated, they've got the highest amount of catching up to do in the country to get to that 90% first dose marker. And we're also aware that we've got a lot of vulnerable people up there in Northland. Some of our other things, wastewater testing, for example, there's a lot of people on septic tanks, which means some of those other surveillance methods that we might use aren't always going to be as effective in that part of the country. So there's a whole variety of things that go into making up that judgment.
Why shouldn't the Prime Minister be forced to isolate off the back of this? If there is suspected unknown transmission, why shouldn't the Prime Minister be forced to isolate?
Well, as I've indicated already, the Prime Minister wasn't in the area of concern, has not been in contact with any known cases, and we do have to recognise that the Prime Minister still needs to be able to travel. Now, if the risk profile changes, then of course we'll reassess that.
Has this case used QR codes, and if so, where are the locations of interest?
My understanding is that they have supplied a lot of information, including QR code records showing where they have been in potential locations of interest, but I'll hand that to the Director
certainly very good records of where they've been, and good use of the app by at least one of these cases who's the one who's out and about in Kaitaia the most. So we've got a very good picture of their movements, and there are some locations of interest that have been published already.
Minister, just going back to my question that I was asking before about timing, when did you find out about this? When were you first alerted to this?
I'll ask the Director General to comment on that, because I was actually having a day off today. It didn't quite work out that way, so perhaps I'll hand over to Dr Bloomfield to share those details.
You'll be aware that we had the case that we announced yesterday. We did a very rapid assessment yesterday, and off the back of that, we're waiting for the other test results. The only other positive test result that came back in was the other household member of yesterday's case. So we decided today to gather all the information we could and do a formal public health risk assessment. That was done this afternoon at 2:30, and then I was briefed at about 3:30 and by the Director of Public Health, and there was some debate about whether or not there was a need to increase the alert level in the far north. However, the Director of Public Health and I settled on the fact that, and this is the most important thing, is that the origin of these cases is unknown. And whilst there are no signs from community testing or wastewater testing of other infectious or infected people in the area, this is our standard thing. We are still trying to eliminate the virus outside of Auckland. And we felt that it was appropriate, therefore, to go for a short period, or our advice was a short period in alert level 3 to allow for that testing and to just make sure there were no other chains of transmission.
You obviously have some
Dr Bloomfield, we know that Northland has got a lot of hard-to-reach communities, both when it comes to vaccination and testing. What resources the Ministry, through the DHB, is going to throw at Northland in the next sort of 72 hours or so to make sure that you actually get this testing done?
Yeah, so there had already been a big effort around testing and vaccination, and the report we had this morning from the DHB was there were people queuing up for testing and vaccination this morning, so there will be an extra surge of both going into this region over coming days. There has been a lot of effort going in already, so it's really just surging in even more workforce to support that.
I know that there are people though who petrol's too expensive, not easily able to get to town. Are you going to throw mobile vaccination clinics and testing clinics out there in the coming days?
We're not personally, but I know that the DHB and the iwi providers and the other providers there have already been using a whole range of approaches.
Before she'd done a press conference?
I don't have that information, sorry. Like I said, I found out, I think, mid-afternoon. I was asked to be available to come in here and do this, so I can't speak for her, but I'm sure we'll be able to supply it.
Dr Bloomfield, you'll have it surely.
Perhaps on this one, I understand that the PM did her media stand-up around 1 o'clock or 2 o'clock, was it? I was briefed at about 3:30, 3:45, and then I spoke with Minister Verrill, who was covering for Minister Hipkins today, at 4 o'clock. So that's when I briefed her on our advice. And the wheels were put in motion.
In terms of the boundary, what does this mean for Rawene and Kohukohu on opposite sides of the harbour?
Did they have any particular concerns? Was it the same?
From the perspective of controlling the cases and any onward infection, they felt really comfortable that they were able to get around the current cases. Their testing of close contacts has already come through negative. They've had a high level of sort of cooperation and been able to find out the movements of the 2 infected people very well, so they're confident about that. And it was really just the concern that they shared with us around the source of the outbreak, and therefore their advice was it would be helpful to have an alert level 3 situation, because then that allowed for high rates of testing and of course vaccination as well.
The cases in the far north haven't travelled to any of the locations of interest or been in the same areas as the existing Northland cases further down south. I guess, do you have any possible theories, or what's your thinking around where they could have caught this? Do you have
we've just so far drawn a blank, and we've got people
caught this? Do you have
we've just so far drawn a blank, and we've got
from yesterday on what the contact tracing capacity is with this new approach?
No, I don't, because I wasn't expecting a stand-up today, but we'll make sure we've got that for tomorrow.
I'll come to the tallies for the last couple of questions.
Yeah, sorry. What the ministry modelling on vaccination rates that you did ahead of the traffic light system, at what point do you see Northland getting anywhere near 90% double dosed?
It really is going to depend on human behaviour, so people coming forward to be vaccinated. It could happen very quickly. We've got the capacity, we've got the doses there in Northland ready to go. We just need people to come forward. I think, from memory, there's about 5,000 or 6,000 bookings in
mid-far north area are coming towards the end of their infectious period. In fact, 3 have now deemed to be recovered.
Okay, we will wrap up shortly, but so we'll just do a quick sweep of questions.
Iwi leaders in Northland asked for an alert level to tighten over a week ago. Are you just not listening to Māori?
Well, you have to have a justification for an alert level escalation, and so these 2 cases clearly produce a justification. That justification wasn't previously there.
Vaccination rates in cases among a population of low vaccination rates, and now you've got unlinked virus, and there might be someone travelling around Northland and that infected them. Why not put the whole region into level 3? Why cut it off when there could be the person travelling around a part that remains in level 2?
It's done based on a public health risk assessment, and again, we followed the advice. As you can see, we were slightly more cautious than some of the early advice that came from the public health teams. But
yeah, I mean, 2 things there. First of all, the risk assessment was that for the whole of Northland, the risk is low, and it's low to medium in this area in the far north. But remembering we also are having testing daily right across